vaccine preventative substances be distributed to providers and to local health departments to then be given to children to prevent 3 more diseases than were compulsory requirements in the preceding section. Then there's other sections of state law, both general and one specific section in the PEIA code that says, and I'll quote, "Additional immunizations may be required by the Commissioner of the Bureau for Public Health purposes to be paid for and administered to children who are covered under PEIA insurance." So in looking at these state statutes all together and trying to interpret what the intent of the legislature was, we determined that the legislature intended to give the authority to determine what vaccines are necessary to the Commissioner of the Bureau for Public Health to decide for kids entering school what vaccines needed to be administered.
Let me just stop you right there. So you're looking at the 1634, which has a specific itemized list, of which none of these on the interpretive rule, the additions on the interpretive rule were included. You are then looking at 1635, which I understand that provides a list which provides free vaccinations to children at the pediatrician if the pediatrician or the parent choose to avail themselves of those free vaccinations. Is that correct?
Not only the pediatrician, also at local health departments, requires local health departments to make those available to children without charge.
But there's nothing in 1635 that is compulsory. Students must have those, children must have those vaccinations in 1635. Is that correct?
It's not stated as a compulsory.
And in the PEIA statute that you cited, it's my understanding that that statute governs similarly a voluntary request for vaccinations that must be paid for under the PEIA insurance program if requested by the parent and if the doctor and parent so choose to avail themselves of that insurance coverage. Is that correct?
That is also true.
And so the PEIA in 1635, which you cited to rely upon for the expansion into the interpretive rule, have nothing to do with compulsory vaccinations. They are just another coverage out there that if somebody chooses to have that coverage, they may or may not avail themselves of these additional provisions. Is that correct?
They're provided to people who want to take advantage of those.
Thank you. You choose to take advantage of those.
Yes.
Thank you. Now let's talk about the expansion, setting aside those things clearly are not going to be a basis for expansion of compulsory vaccination. In 1634, in the interpretive rule that you've laid out, where is the authority that says that an interpretive rule may have vaccinations or other requirements in it which would prohibit school children from attending school?
Well, there are general laws governing public health, and in 1614, under proposed rules by the Secretary, both the Secretary and the Commissioner of Public Health are authorized to regulate and supervise other rulemaking that's not otherwise assigned in the chapter, and that is an authority to protect the public health, providing the greatest number of vaccines, and particularly with the mumps example that you cited. Mumps is part of the MMR vaccine, so it was more or less an oversight in the enactment to have not included mumps, and most children were getting mumps. But we wanted to make sure that there was clear guidance, both to providers, local health departments, and to parents and school personnel, as to what vaccines would protect the greatest number of children from the greatest amount of disease exposure. And we passed the law to add measles, mumps, and rubella and made an interpretive rule.
The Commission passed the law.
We promulgated it, yes.
I want to go back just a second and sort of answer, if you could, for me, the technical question where your authority or any administrative agency's authority to pass interpretive or adopt interpretive rules rather than legislative rules or emergency rules comes from. Is that under the State Administrative Procedures Act?
It is. There's several references to it in the Secretary of State's website. I don't have that document with me, but I've looked at it before, and it basically says it's a way for a state agency to explain
Education, is it the West Virginia Department of Education's position that based on this interpretive rule,